Maria Holder Diabetes Center.
The only difference between a glass of orange juice and a glass of Coke is that the orange juice has some vitamin C in it. They both have almost the same amount of sugar.
Man, that's Santa Claus passing through already?
Not yet, but it's time for 15 diabetic-friendly December minutes, all brought to you by the Barbados Diabetes Foundation.
So after they Santa Claus happening in today's show.
When we have the conversation about healthy eating at times such as Christmas, something I just first like to remind people.
What does Victoria Coates, the dietitian, want to remind people for Christmas? You'll have to listen to find out.
I can listen, cause I'm malicious.
Diabetic retinopathy is a description for the effect of diabetes on the back of the eye.
Dr. Charles Pierce gives you an in-depth analysis on diabetic retinopathy and why you should get your ice cream before Santa Claus comes. All this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Ice Creaming Program, and the bank that can make your Christmas dreams a reality. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money, but members get 10% off.
A happy December morning, VOBers! Peter Boyce here. You might be listening to your radio now. You might be saying,
Wait, December now start and it's the 6th already? Well, it can soon be Christmas. Cause I was diabetic and I was supposed to get my ice cream for this year. But then I had Quapova, and then I had Carrie Festa, and I was busy rocking out like a skate. So I didn't get a chance to go.
so the year is coming to an end this month. So if you are diabetic, you need to proceed expeditiously to the Maria Holder Diabetes Center in Warren, St. Michael, right behind Eunice Gibson Polyclinic, and get your ice cream for diabetic retinopathy before the year done. But if you are a doubting Thomas or disbelieving Mary, and you would like to get more information on the screening program, listen to this.
The Maria Holder Diabetes Center, located in Warren, St. Michael, currently has their Barbados Diabetic Eye Screening Program on, inviting all Barbadians with diabetes to have their eyes checked for diabetic retinopathy. We asked Dr. Charles Pierce, clinical lead of the Barbados Diabetic Eye Screening Program, what is diabetic retinopathy?
Diabetic retinopathy is a description for the effect of diabetes on the back of the eye, the retina. Diabetes affects mainly the blood vessels in the eye, and it causes two processes. You can either have leakage, which we see as yellow deposits around the back of the eye, or it can obstruct the blood supply to the retina, which leads to a process called ischemia. And as a result, the body starts to produce these abnormal blood vessels. Because of this abnormality, the blood vessels are more fragile than normal blood vessels in the retina, and they can start to leak as well as to bleed. And this can cause a sudden loss of vision. It can also cause scarring to the back of the eye and a condition called tractional retinal detachment. These are the processes that we wish to try and avoid from happening.
How does the digital eye screening done at the Maria Holder Diabetes Center identify diabetic retinopathy, in contrast to screenings by your regular optician?
The main difference between the process at the Maria Holder Diabetes Center is that we take a photograph of the back of the eye, and with this photograph we can manipulate the image, so we can enlarge it to see if there are any very subtle changes that are happening in the retina. We can change the contrast so that we can see if there's any findings that you might not actually see by just looking at a regular color photograph. And also we can compare it to your previous images to see if there's any evidence of progression. That's the main difference between what we do and what happens when you go to your optometrist or optician for a routine follow-up.
How often should a diabetic have their eyes checked?
This very much depends on how advanced the diabetic eye changes are. So if you have no diabetic retinopathy or very mild diabetic retinopathy changes, then we only need to see you once a year. If you have more advanced changes, you may need to be seen more often, and this could be every 6 months or every 4 months. This is for the surveillance process where we're monitoring to see if there's any progression of these more advanced changes in the retina.
How important is it for a diabetic to have their eyes checked?
So this is a very important question. The main reason that we monitor or have a screening process in place is to pick up early changes in the retina before they reach an advanced stage where intervention is unlikely to have the same effect. So what we're trying to do is pick up these diabetic retinopathy changes before they reach a stage where our intervention with an injection in the eye or laser will have less of an effect, and we're less likely to preserve vision or improve vision.
If a person has already become blind from diabetic retinopathy, can the Barbados Diabetic Eye Screening Program reverse that process?
Unfortunately not. So that's what we want to try and avoid. We want to pick up these changes before they reach such a stage that there's loss of vision where our current treatments are not going to be able to reverse the changes that are there.
How effective has this eye screening program been in other countries?
So the example we use across the world is in the UK. Previously, diabetic eye disease was the leading cause of blindness in the working age population in the UK. And as a result of their successful public screening program, it no longer is. And we want to try and replicate those findings here in Barbados and reduce the loss of vision, the blindness as a result of diabetic eye disease.
Contact the Barbados Diabetic Eye Screening Program today at 243 Eyes 243-3937 to find out how you get your simple digital eye screening done.
You know what would be a good Christmas present for yourself? You saving your eyes. So you already know what you have to do. Call 417-0305 and make that appointment to get your eye screen here. Good. So now we're moving on to talk about something that Bajans love to do at Christmas.
What's that? Drive out and look at Christmas lights.
No! Eat! We love to eat our bellies full at Christmas and yam down the place. But you might be wondering if it's possible that you can eat at Christmas but still eat healthy. Victoria Cox, dietitian with the Maria Holder Diabetes Center, she has a message for you.
When we have the conversation about healthy eating at times such as Christmas, something I just first like to remind people is that eating maybe a little bit less healthily or eating things that you don't usually eat, if only on one day, is less likely to have significant impact on your overall health. However, it's when we sort of drag this, Christmas eating out over the whole month of December, so starting from Independence right the way until, after New Year's, that the additive effect of this less healthy eating is going to, ultimately affect our health. And so it's just something to be mindful of, that you really want to try and save special dishes, special treats to, maybe actually Christmas Day itself, and try and isolate these incidences rather than drag it out for the entire month.
Thank you, Victoria Cox, for giving us that information on one of the things we love to do at Christmas as we go into our Saturday Christmas song of the day. And this is the Dread Stew with The Things of Christmas. Compliments the Maria Holder Diabetes Center and Republic Bank.
The children wait for Santa to bring them some ice cream.
Maria Holder Diabetes Center.
Hear them promise Mama to do no more.
Another service which is available at the Maria Holder Diabetes Center is vascular or ABI screening.
Who should get this screening, boy?
Persons living with diabetes, persons who experience pain while they are resting, or a burning pain sensation in their legs or toes. If you have what is called bad circulation, if that sounds like you might need this vascular or ABI screening test. Let's hear what vascular sportsman Donald Clark had to say.
I should indicate that this is not a male-only condition because of erectile dysfunction, but female condition as well. Ladies with varicose veins have their condition to have this ailment. So I would want to say that women should also have this test done. Again, peripheral artery and peripheral vascular, which is different because arteries are arteries and veins are veins, but varicose veins is a telltale sign that there's a problem with peripheral vascular disease. In men, of course, it's erectile dysfunction. That is major. That's how you tell that there's a problem. That's how men would normally tell that there's something going on, there's no blood flow, or there's, I should say, reduced blood flow to the penis, of course, but in women, varicose veins is a telltale sign that there's also a problem. Peripheral artery disease, it's a simple test. It's called an ABI test, and I can't stress enough the importance of getting this test done.
In 2025, the Maria Holder Diabetes Center, located in Warren St. Michael, with their diabetic eye screening, vascular screening, and podiatry services, offers a standard of diabetic services that equals or surpasses any you might receive internationally at a price that everyone can afford. So if you are diabetic or pre-diabetic and listening to VOB right now, call and make an appointment to get your eye screened for diabetic retinopathy by calling 243-3937. Or if you are having vascular or circulation issues or need to see a podiatrist or nutritionist, call 417-0305. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center. Until next time.
The only difference between a glass of orange juice and a glass of Coke is that the orange juice has some vitamin C in it. They both have almost the same amount of sugar. And when you think about sugar in grams, that really doesn't mean anything. But if you divide it by 4, every 4 grams is 1 teaspoon. And that is a very powerful image.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
The Maria Holder Diabetes Center.